Sarcomas are a type of cancer, and they're really derived from the connective tissues in the body, which is why they can show up anywhere in your body. And they can arise in a bone, those are bone sarcomas, or outside of a bone, which are typically soft tissue sarcomas, like Sarina's. They are quite rare. Overall, I think they're less than 1% of cancers that are seen, particularly in adults. They're a little bit more common in kids. And there's about 16,000 new sarcoma diagnoses every year. Early diagnosis is definitely really important when it comes to sarcomas. Recognizing that a lump or a bump or leg pain or arm pain or whatever it might be could be a sarcoma is really incredibly important. That's why we really think about these red flags. A lump or a bump that can be small but definitely greater than 5 centimeters in size. A lump that's like deep is definitely concerning. It can be painful or not painful, but pain that's getting worse is concerning. Pain that is out of proportion to an injury or you don't know where that pain came from. These are some of the things that we think about that raise our concern and our level of suspicion for sarcoma. One of the other really important things in impacting patient outcome is where they're treated. Having a patient treated in what's considered a Sarcoma Center is incredibly important. And these are centers that typically have a team of doctors, including oncologists, whether it's adult or pediatric, that are experts in sarcomas, typically orthopedic surgeons that are orthopedic oncologists and also sarcoma experts, radiation oncologist, having the right pathologist to make the diagnosis as well. Not any oncologist out there can treat a sarcoma. You really want your patients to be seen at places that are known or designated as sarcoma centers. Another really important thing to consider is both getting imaging of whatever you're concerned about before attempting to do a biopsy or any type of surgical intervention, and also sending the patient to somebody who is an expert in these types of tumors prior to doing a biopsy, if at all possible. There can be a lot of damage done if a biopsy is done incorrectly or prior to imaging. We really encourage patients to be sent to places that have expertise in these types of tumors to have biopsies done. However, if that's not feasible, limiting it to maybe a simple needle biopsy to decrease the risk of contamination or other complications related to trying to do a biopsy, A, without imaging, or B, without having the expertise to do so.
I'm Sarina Morrison, and I am a sarcoma survivor. My experience with cancer was a lot of things. It was terrifying, it was painful, it was confusing, but also in a lot of ways it was kind of amazing. And looking back, I look at my experience with cancer and my diagnosis, and I realize that my diagnosis from the get-go was one of the greatest blessings that I experienced throughout my entire treatment with cancer. And at the time, I would not have described my diagnosis as a blessing. In fact, I thought it was one of the worst things that had ever happened to me. But knowing now what I know about sarcoma, knowing how rare it is and how often it's misdiagnosed, and how detrimental those misdiagnoses are to one's survival rate, I realized that my diagnosis was an incredible blessing. And some might call it luck, and some might say it was just good fortune, but I really think it was a blessing. I was 23 years old, and as far as I knew, I was healthy when I was diagnosed. And I first felt something going on in about October of 2014, and I noticed a lump in my right thigh. In fact, I thought it was a knot. I'm 23 and healthy. I am a runner. I have an avid social life. I work full time. And I think that I have just a knot in my leg. I'm so sure, in fact, that it's just a knot that I at one point let my roommate try to roll it out with a lacrosse ball. But unlike a knot, that didn't help. In fact, it hurt really bad. And unlike a knot, it didn't get better with time. In fact, within a couple of weeks, it started to swell so that now it's a visible bump in my leg. And I know most people think like, okay, so you went to the doctor then, right? You went and got it checked out. But put yourself in my shoes. I'm 23 years old, and as far as I'm concerned, I'm healthy. So I ignored it. And then by Thanksgiving time, it was continuing to swell. And at this point, it was so large that I could no longer fit into my jeans. And at this point, it's painful. And so I know you think like, okay, so now she goes in. But as far as I'm concerned, I still have nothing to worry about. And on top of being 23 and healthy, my insurance year started over on January 1. And I didn't want to go in and get it checked out and have to pay my deductible, then find out it was something that I needed physical therapy or surgery or something for, and have to pay that deductible a second time after the holidays. So I just continued to let it be. And it wasn't until early December when my mom finally told my dad what was going on that he insisted that I go get it checked out. And he even offered to pay my deductible. So I agreed, and I went in, and I just went to a local clinic right by my work, and I saw a general practitioner there, because at that time, I didn't even have a primary doctor, because I'm 23 and healthy and had no use for a primary doctor. So I went and saw this general practitioner, and she checked it out. She told me it was probably a cyst. It was possibly an injury that had gotten worse because I had left it untreated. But because of the size of it, she didn't think that an ultrasound would be able to tell us what it was. And so she wanted me to get an MRI done. So I agreed. I said, okay, I'll do an MRI. And I don't know if she realized how stubborn of a person I was, but she looked me dead in the eyes and she goes, Sarina, promise me you will get an MRI this week. And I definitely wasn't planning on doing it that week because I know MRIs are expensive. But I was like, okay, she seems really serious. So I promised her that I would do it that week. And I am a woman of my word. So I made an appointment for that Friday. And I went in and had the MRI done. And then I went about my weekend as any normal 23-year-old would. Monday comes, and I'm at work, and I'm standing at my standing desk because I'm 23 and I'm healthy. And the general practitioner that I had seen calls me, and she asks if I've got a few minutes. And I'm like, yeah, I'm at work, but I got a few minutes. I want to hear what she has to say. And she tells me that they've got the MRI results, and they've been read, and I have a tumor, and it looks like it could be a sarcoma. And I have no idea what a sarcoma is. But then she tells me that I need to come in for a biopsy to determine if it's benign or malignant. And I do know what those words mean. But what really scares me is then she tells me that I need to come in, and I can come in on Wednesday at 11 a.m. or I can come in at 3 p.m. And never in my life has a doctor told me when I'm going to come in. You know, usually there's this whole rigmarole of they ask when I'm available, I tell them they don't have availability, and then it's like 3 weeks out. But she's telling me that I'm going to come in just 2 days later, and I have 2 options. So I tell her, okay, you know, 3 p.m. that, you know, disrupts my workday a little bit less. And then she continues speaking, and I don't know if she's telling me more about sarcoma or if she's telling me details about this biopsy appointment, because at this point I have entered a complete state of shock. And then she pauses, and she's quiet, and I'm quiet because I have no idea what she's been talking about. And she asks me, Sarina, are you writing all of this down? And I'm like, no, I'm not writing all of this down. Should I be writing all of this down? And so I go to grab a pen, and that's when I realize I can't even pick up a pen because I am shaking so bad. Because in that moment, I have no idea what I'm facing. And I'm so grateful then when she asks me if I would like it, if she would give me a call back in a few hours, once I've had some time to process, maybe call my mom and talk with her. And so I tell her, yes, please, that would be wonderful. And so she does that. And so I get through the rest of that day, and I get through the biopsy 2 days later. And then they tell me that I should have results from the biopsy. If I'm lucky, I could have them that Friday. Otherwise, by Monday the next week, I should have results. And Friday comes, and there's no results. And then Monday comes, and there's still no results. In fact, I have to wait a week and a half. It's not until the following Friday that I hear back. And then I get the second worst call of my life. And the surgeon that had done the biopsy gives me a call. And he asks me if I have a few minutes. And I'm like, yes, I've been waiting for this call for a week and a half. I have a few minutes. And he tells me it looks like I have cancer. And in that one moment, I'm 23 and healthy no longer applies to me. And I cannot emphasize enough how inconvenient that cancer diagnosis was. There was absolutely no part of me that thought, gee, I'm really blessed that I was diagnosed that quickly. Or man, I'm sure glad that general practitioner knew well enough to tell me to get an MRI done right away. Because at that point, I was just devastated. And as inconvenient as I thought that diagnosis was, I had no idea how inconvenient it really was. It wasn't probably until a week later that I finally was able to be seen by Dr. Greengard and really learn what my treatment was going to be.
I think there's so many different things that can be learned from Sarina's story, and it's inspirational and educational and enlightening, and but some of the, I think, really important things that Sarina's already mentioned are how rare sarcomas are, and that a lot of people have never heard of a sarcoma. We see them in kids, we see them in adults. Sarina was a young adult, but ended up with a pediatric oncologist because we often see a lot more patients with sarcomas than adult oncologists do. Sarcomas really can arise from anywhere in the body, and they can be multiple different types of sarcomas, and so the treatment can include many different things. Treatment for sarcomas includes chemotherapy, surgery, and radiation. And then there are some sort of newer therapies that are being investigated, more targeted treatments as well, that can sometimes be a part of the treatment. We know how important it is to get a diagnosis early, and we know that usually not when people get to the point that Sarina got to, but when diagnoses are delayed, that outcomes are not as good. And that's for several reasons. A lot of times, if diagnoses are delayed, the surgery is not always as easy. Can be really hard to get the entire tumor out. For some people, that means needing an amputation instead of just having a surgery that spares the limb if there's a limb involved. Delays in diagnosis can cause the cancer to spread or metastasize, and can decrease their chance of survival. For Sarina, she, I think now, realizes how amazing it was that her initial provider that she saw encouraged her to get an MRI so quickly, because that's not always the case. There are a lot of things that we really need to think about when seeing a patient like Sarina that raises concern that maybe you do need to get an MRI sooner rather than later. These lumps and bumps can be anywhere in the body, and they can be painful or not painful at all. Something greater than 5 centimeters or the size of a golf ball is really concerning and really needs to be further evaluated with an X-ray or even better, an MRI.
So the first time that I met with Dr. Greengard, we didn't have a final diagnosis yet. We knew that I had a sarcoma, and I think at that point we were pretty positive it was a soft tissue. But it wasn't narrowed down from there, the type and the grade. So I know I personally was really frustrated that we weren't able to determine what my treatment was going to look like because we didn't know exactly what kind it was. And then it was 4 or 5 days later, and we were still waiting to find out. And the tumor was so large, it was pressing on all the muscles surrounding in my leg, and it was so much pain. I was in so much pain. I was having trouble sleeping. I was having trouble walking. It was on January 1st. I was in the hospital when we got the final diagnosis of what kind of sarcoma I had. And I had soft tissue sarcoma, not otherwise specified. And I had a high-grade tumor, meaning it was just very aggressive. That's why it had gotten so large so fast. And so she told me that my treatment plan was going to be chemotherapy along with radiation, and then also surgery, followed by more chemotherapy. And that if everything went well, it was going to take 6 months of treatment. A lot of weeks of physical therapy after the surgery. I'm very, very lucky that it wasn't any worse than it was. I'm still able to walk perfectly normal. Nobody would be able to tell a difference other than me. I'm able to run. I've actually completed 2 marathons since my treatment, so I really had something to prove.
I think one of the super important things too that we haven't really mentioned is that when somebody is diagnosed with a sarcoma, they undergo staging, which is usually for most patients with a sarcoma a PET scan. And one of the blessings in Sarina's story was that her tumor had not spread or metastasized to other parts of her body. We know that part of what determines whether a tumor spreads or not is, the biologic behavior of the tumor itself, but also, how timely the diagnosis is made, and that having delays in diagnosis can definitely increase the risk. Sarina's treatment was 6 months long, but certainly patients don't, the side effects don't stop when the treatment stops. And I think there are some ongoing side effects that do get better, but for many people, the fatigue that you experience while on treatment can persist for several months after chemotherapy, radiation surgery, all of that finishes. And usually that does get better with time, but it, I think, lasts for longer than most people think. patients need to be followed for really the rest of their lives to make sure that they can stay as healthy as possible and to monitor for the long-term effects of treatment. So some of the common things that we look for are monitoring the heart to make sure the heart continues to work as best as it possibly can, because one of the medications that's commonly used, anthracyclines, can hurt the heart. We monitor kidney function both acutely during treatment but for years after. There is unfortunately the risk of secondary cancers with some chemotherapy and radiation as well. And there's a risk for infertility for both men and women when they're treated for sarcomas, which can be obviously a devastating problem for a lot of people.
So with my treatment, so 6 months is, I completed treatment, and then you go to Aftercare. I would come in every 3 months for follow-up for the first year. And then after that, moved to every 6 months, and that's where I'm still at. I still come in every 6 months, and we'll do that until 5 years, which will be this June. Very exciting, yeah. When I finished treatment, there's kind of this moment where you're like, okay, I'm done, and you think it's going to get all better. But those first 3 months, I was still on an antibiotic those first 3 months, and to be totally honest, I didn't really feel better at all. But you're done, and so people expect you to feel better. And so, I was expected to go back to work, which I did, but I struggled. It was really hard. I was scared because, you ask your doctors, well, how long will this last? And they say, well, it's all in, the relative norm where it could last 3 months, it could last 2 years, and it could last forever. There's not a lot of concrete with cancer and post-cancer. I struggled a lot with my memory, just little things at work where I would normally remember, a conversation I had with somebody. If I didn't take notes, that conversation was as good as gone. Chemo brain, yeah.
It's a real thing.
It's such a real thing. And again, I would ask, like, okay, well, how long does this chemo brain last? And it was like, well, it could be forever, or it could be a few months, and you just don't know. But there was no sympathy. People will ask me often when they have a friend or a relative that gets diagnosed. They're like, well, what can I do to support? And it's like, one thing I always mention to them is like, remember that it's not over when it's over. Mm-hmm. You don't know what they're going through. I think most people look at it as like, okay, Sarina goes in once every 6 months and gets good news, and that's it. And they don't realize that once every 6 months, I start to have nightmares and this anxiety build. And yes, it's gotten better with time. It's not nearly as bad at the 4-year mark as it was at the 1-year mark, but it still gets there.
And I often hear more so from parents, just because I take care of a lot of kids, but that like the anxiety is just skyrockets at the end of treatment and for the first several months, years, whatever it is, after treatment, because you're no longer in the fight and you're no longer actively doing something to treat it and keep it from coming back. So you're dealing with like not only just the physical effects of your treatment for months, years, however long after, but also the emotional impact of having cancer and how that changes your life forever.